Hey there! I'm guessing that if you're watching this video, you want to know this number one secret to getting rid of prescription medications while getting a thumbs up from your doctor. So my name is Vixen Dynas, and I'm founder of Virtue Health. Virtue Health promotes healthy living through patient education and identification and resolution of medication-related issues. It's a tongue twister. We work collaboratively with patients and their providers and act as a liaison and patient advocate across the healthcare system. So together, we promote wellness goals and we improve quality of life. So I've been a clinical pharmacist for almost 14 years now, and I've had the privilege to help many patients achieve health and reduce risk factors. One of the greatest things I got to do is at one of my hospitals, I was able to create and start a medication therapy management program. So it's kind of a wellness program, but on the medication side. And basically what we got to do was sit down and visit with our patients and talk about their disease states and talk about all of the medications that they're taking and identify any barriers to care. And basically we were able to work with their providers, and if they were missing something or if they were having trouble with something, we got their prescriptions changed, or we added a prescription, or maybe we told the patient that they didn't have to take something anymore, and whatever was appropriate for the patient. And it was great to see the impact that we were having on patient care. But there was one thing missing during all of this, and I noticed it then, and I found myself wanting to do something about that, and so that's why I've created Virtue Health. But that's that secret that I'm about to let you in on. But first, before I do that, I'm going to tell you a little story about myself. So when I was 30, I had my first child, and I was pretty fit at that time. And I always had to watch what I ate, and I had to stay active and exercise. But when I was pregnant, I was like, I'm eating for two. So it was like cereal and milk 3 times a day because that's my favorite. And my husband has a sweet tooth, so he brings me home ice cream, and I would eat like a whole pint of ice cream at a time. And by the time I had that baby, I had gained 70 pounds, and he came out only 7 pounds. So that was not baby weight, guys. That was all me, right? And so after that, I was very ashamed, and I had to work hard to get rid of it. And luckily, a friend of mine let me in on this secret that I'm about to tell you about. And I was able to get the weight off, and I felt much better after that. But then again, in my mid-30s, I got pregnant again, and this time it was twins. So, cereal and milk for 3, guys. 3 times a day, and again, a pint of ice cream at a time before bedtime. It was wonderful. Let's just say I like to eat, guys. But then this time, the babies came out and they were each 5 pounds, and I had gained 90 pounds, guys, and I was on blood pressure medications this time. And so let's look at this BMI chart I got here. I gained 90 pounds. So I'm looking at this BMI chart. If you've seen these before, you just kind of take your height. I'm 5'6", and I was over here in the yellow range. I was obese, guys, and I was on a high blood pressure medication. I didn't want to do that. I also was down here, obese women, BMI over 30. I had increased my chance of developing diabetes by 1,240%. I also had increased my chances of developing, high blood pressure, which I already had, but high cholesterol, non-alcoholic fatty liver disease, GERD, if you guys have heard of that, gastroesophageal reflux disease, cardiovascular disease, and depression. And also I was at risk for shortening my life, right? So I didn't want to do that, and I don't think most people do. So this is kind of leading to the super big secret that I need to tell you guys about. And basically it's lifestyle changes. So luckily for me, I went back to that secret that I knew about, and I was able to lose the weight. And it was empowering to know that I have control over my body, and I can do something about it, my health, right? And you guys can too. So the big secret is lifestyle. I think you guessed what I was alluding to. So we all need to make sure that we live a healthy lifestyle. We need to get a small amount of exercise, whatever we can tolerate. And we need to eat right, and we need to have a healthy weight. So we all, most of us sit at a desk all day, and we, eat salads, sandwiches and pasta, and, whatever the American diet seems to think is normal, but the truth is it's not normal for our bodies. We were hunter and gatherers, so our bodies are not used to taking in all this carbohydrates and all this fat that we eat, and so that's how most of us get here into trouble with our healthy weight and our lifestyle. So I want to offer people something to get healthy, and that super big secret that I was able to use to get healthy was Ideal Protein Weight Loss Protocol. So Virtue Health offers the Ideal Protein Weight Loss Protocol, and so if you clicked on this, you also probably saw my offer, and I recommend you guys take a really good look at it, because it is impactful and it is empowering to know that you can take control of your health. And so if you guys are already facing high blood pressure or high cholesterol, or you want to avoid facing those problems, this is a great idea. And so, and it's attainable, guys. It's doable. The CDC says that if we just lose 10% of our total body weight, we're going to have significant impact on things like high blood pressure, high cholesterol, and blood sugar control. So it's not like we have to be super skinny. I'm not. I got a lot of ways to go, but I'm healthy enough that I'm not going to have, I'm not adding the risk factors to developing those diseases. And so I want to get other people there too. I'm also not saying that if you are on medications, you're definitely going to get off them. Some of us, we're not, but a lot of us can, and I want to try. And even if you're still on medications, at least, perhaps we can improve your health and reduce your risk factors for having problems, later in life, like heart disease and heart attacks and stroke and, shortening your life or, having poor quality of life. So I want to improve health. I want to empower other people to improve health. So I encourage you to take a look at Virtue Health and see if we can work together to improve your health. You guys take care.